Hello everyone, my name is Destiny Jackson, and I am a student in the RN to BSN program at West Virginia University of Parkersburg. We were tasked with doing an oral discussion board post for our Nursing 311 course. So today I'm going to talk about the Affordable Care Act and how it has changed healthcare in our communities. Since it started in 2010, the Affordable Care Act has been one of the biggest changes to the American medical system. It wasn't just about insurance cards. It was about changing the way people think about health. The goal was to help more people get covered, keep costs from spiraling out of control, and make sure the care people receive is actually high quality care. As we look at our local clinics and hospitals today, we can see how this law has changed the way we care for our patients every single day. First, let's look at access to care. Before the Affordable Care Act, the majority of people in our town only went to the doctor when it was an absolute emergency. As I live in a very rural, farming-heavy town, my neighbors might have been denied insurance because of a health problem they already had, or they simply couldn't afford a plan. Now, with Medicaid expanding and the insurance marketplace available, more of my neighbors have coverage. For those of us working in the medical field, we see this change in our waiting rooms. As I work labor and delivery, I see this as instead of seeing a patient for the first time for delivery when they are in a crisis, we are seeing them for regular checkups and screenings because the law covers pre-existing conditions. People aren't afraid to go to the doctor anymore, and that means we're catching things like gestational hypertension before it turns into preeclampsia, or gestational diabetes much earlier. When it comes to the cost of care, the impact is a mix of relief and some new challenges for many families here. The Affordable Care Act has been a huge help because of the tax credits and subsidies. Many people can afford a monthly plan for the first time. The law also stopped insurance companies from putting a limit on how much they would pay for your care, which protects families from going bankrupt if there was to be a serious illness such as cancer. However, we have to be honest that it hasn't been easy for everyone. Some small business owners and people who don't qualify for help have seen their premiums and deductibles go up. So while the law has helped millions of people feel more secure, the rising cost of private insurance is still a real concern for many in our community. Finally, the Affordable Care Act has really pushed for us to improve the quality of care. We have moved away from the system that just paid doctors for the number of tests that they ran, and moved more towards a system that rewards good results. For example, our local hospitals are now much more focused on follow-up care. There are programs in place that encourage hospitals to make sure patients stay healthy after they go home, so they don't end up back in the hospital a week later. We're also using more technology like electronic records so a patient's doctors can actually talk to each other and share information. This makes healthcare safer, prevents mistakes, and makes sure the patient is always the main focus of the care team. Thank you for your time, and I look forward to hearing your perspective on such an important matter. Thank you so much. Have a good day.